So what is important in the assessment? So he has grade 2 to grade 3. It is in between 2 and 3. So we have to assess the amount of gland. So we will touch the tissue. If it is hard, it is a gland. If it is soft, it is more of the fat. Second thing is the quality of the skin. We have to assess whether the skin will retract back nicely, or we have to add the skin tightening with the body tight procedure. So in this case the challenge was there is a huge gynecomastia, so we have to remove the gland and we have to do the skin tightening also. If you see his picture from the side, again in this view you can see there is a lot of fat and the gland, especially in the just behind the nipple and in the lower part. Second thing to highlight is I always ask my client for the upper chest, whether they want the upper chest to be very flat or they want the convexity which looks very muscular. And in this patient he wants that the upper chest should be convex, so we have to concentrate more on the lower chest. This is whole gland and the fat, grade 3. This is grade 3 gynecomastia. So the treatment is according to the grade and according to the amount of the fat and the gland present in the chest. So gynecomastia is basically the gland and the fat in the chest area. So sometimes it is small, the grade 1, a bigger, maybe a grade 2 with the loose skin, and sometimes it's almost a female-like chest. So we have the ultrasonic liposuction, which is the best technology for the liposuction. So lipo is the fat and suction, we suck out the fat. So you can see this is the result at just 4 days. So we have removed whole of the gland, especially from the lower pole and the lateral side. So this is a chiseled chest at just 4 days, and we have done liposuction from a very small cut in the axilla, so only one cut for liposuction, and there is a small cut in the areola for the gland removal. So to highlight, I always believe in the complete removal of the gland. So this is the complete removal of the gland, and the skin will retract back over few days or few weeks. So this is just 4 days, so we advise the client to wait for 1 month. He has to wear the pressure garment and there will be a better skin retraction, but we are happy to see the result at just 4 days. So we need the bulge in the upper pole. So this is the muscle. So if you see any chiseled chest or a chest of a model, so there is a lower pole that is 1 to 2 centimeter below the nipple. There is a horizontal line. So I always try to achieve this lower pole horizontal line. So there is a complete removal of the gland. And second is the lateral line. So this is the lateral line. We always remove all the excess gland and the fat in the outer or the lateral side also. So you can see this is round, then there is a dip here. This is again round in the central part. There is a dip in the midline, and there is a dip on the lateral side on the both the sides.
I'm suffering this since maybe like 8 years or something, and my result देखा और थोड़ी ही swelling है और already मैं बहुत खुश हूँ और shape होएगी थे. It's a best experience ever.